I now take the pleasure of welcoming once again Dr. Shweta Prabhakar, Head Quality and Patient Safety and Academics at Fortis Hospital, Mohali. After completing her graduation from Maharani Lakshmibai College, Jhansi, she went on to do her post-graduation from Dr. Aramal Hospital, New Delhi. She brings to the table 21 plus years of experience in clinical and service quality, having worked at multiple administrative levels. Besides being a senior NMBH assessor, she is also JCI coordinator for Fortis, having numerous paper publications in peer-reviewed journals and reputed chapters to her credit. She is a part of the GAO Governing Committee member and chairperson for the North Zone. She is also program director for the GAO Student Research Wing and Patient Safety Program. She is a Quimpro certified level 3 qualitist. I now invite Dr. Prabhakar to share her insights with the audience today on risk management in BME. The floor is all yours,
ma'am. Thank you, Dr. Sudeshna, for the kind introduction. Key considerations for any medical device or biomedical equipment with respect to risk assessment. Now, we all know Chanakya, and one of his philosophy was that the person who can foresee the problems and difficulties and identify proactive solutions will definitely live happily. So that is one of the philosophies I try to follow. And with this, our learning objective for today would be a brief introduction about it. I would not take much of a time, but definitely would, try to explain about the risk management process and what are the tools and techniques which we use in the biomedical equipment management with respect to the risk and the challenges. So before we move on to the actual risk management process, what is an hazard and what is a risk? This is a very common question which comes across when we talk about risk assessment. So hazard is something that has got the potential to harm. And when there is a likelihood of the hazard causing a harm, it becomes a risk. This picture explains me when I hit the beach at 10 o'clock and in the morning, and when it's by 1 a.m., I am actually exposed to the hazard. So the risk definitely has precipitated. And if you are not protected, so then definitely there is a harm, but definitely you should always look for risk assessment and effective controls to protect you from the hazards. Do we see risk also as an opportunity? There is always a positivity in everything adverse happens. So we should always look at risk, identifying risk proactively and taking it as an opportunity to implement effective controls. So what is risk assessment? Now, risk assessment is basically a process where you identify, analyze, and mitigate risk. And how does it happen? It happens with teams and with an effective, the protocols which you have listed out, and you would work on the risk assessment with respect to design and any particular product which you are developing. So in this, when we are talking about the biomedical equipment, so it can be any medical device. When, I would refer to my fellow speaker from the DOSI, Ms. Pooja. She was talking about various risk assessment they had to undergo to attain certifications for a medical device to be FDA approved or certain approval levels or certain certifications. So a lot of risk management at that particular when you're developing a process, developing a device. So it starts with, it's a 5-step process, very, very basic, but you have to establish that context, that what are you doing, in what context you are identifying the risk, then identify the risk. It's very important that you should know, keep on asking what if and what if. So that would lead to your identification of various risk factors and who's involved and what is the risk, what is the level of risk is there. And then move on in the process of analyzing the risk. When we analyze, there are a few questions which should come in the mind. Is that how did it occur? What was the likelihood? What are the consequences of that risk? And various, set of questions you have to draw in when you analyze the risk. And these would be, there are various tools which are available. So in the interest of time, we cannot go to each and every tool, but definitely we would look into particular, I will explain in subsequent slides about how you analyze the risk with terms of, using a risk matrix, and then you prioritize the risk. So once you have identified the risk and prioritize it, you have to treat the risk, evaluate and treat the risk. So In that, you need to, when you treat a risk, the risk cannot be, it just cannot be, zero. The risk would be there if you have identified it. Now, what you can do is that how you can treat is you can avoid the risk completely, or you can reduce it to a minimum, or you can transfer the risk, and then you can either retain it if it is very low level of a risk, and or you have a effective control mechanism too. So these are some of the terms which you will come across when you treat the risk. So this is a very, very general process explained about the risk management process. And with this overview, one has to understand that the top management or the leadership has to take on the lead when you implement any risk management plans or any risk assessment in your organization. So there should be a proper, teams and committees, and the leadership should be part of that particular risk assessment teams. And definitely where the risk can come from, it can come from various, sections or in the organization, either from the system or maybe the team who's delivering it, or maybe from the organization. Here we are talking about the equipment. So equipment itself can pose a risk. So we need to have all those certification to ensure that that particular equipment or a device is safe. And these are some of the responsibilities. So obviously, when you identify a risk, and they would be analyze the risk, and so there are certain responsibilities are assigned when a risk manager which handles it. So what are the tools for risk management? So you will be using either a proactive tool or a reactive tool. Now, what happens is that whenever there is an adverse event happens, right? Suppose there is a particular equipment is, if I'll give an example, I'll take you through an example. If an, infusion pumps are placed at the bedsides in the ICUs, and there are at times the patient are undergoing around 5-6 infusions, and there are like kind of a battery of infusion pumps which are being placed on the side, and there are lines, there are IV lines are being run, and sometimes if you don't see that particular line is directly placed above the infusion pump, there are some leakage, and it would cause a short circuit in that infusion pump, and they might lead to a fire. So there is an incident which has occurred. Now, what happens is that if there is an incident, you react. So that is a reactive approach. Then you would do an RCA, you would identify what has happened. So when you will do a viva analysis, why it happened, so then you would, that would lead to you that, yes, that was the reason why there was a short circuit, because there was an infusion which was running through on the IV line, which was running above the infusion pump, and it was leaking, and it was causing a, it caused a short circuit. So this is a reactive approach. A proactive approach would be when you just move around and you do a proactive, rounds and see and check, and you've already know that there could be one reason. Electrical safety is very important when we are using so many equipment, especially in ICU. I'm telling you, whenever many of you must be visiting ICUs or have seen ICU setups, it is really alarming when we need to be seeing all those equipments around the patient. We also need to ensure that the patients are safe and our environment is safe. So that is a proactive approach, that you have already identified that this, if it's leaking, that IV fluid above the infusion pump is leaking, and it might cause a short circuit. So you would change the design, or you would place your the IV fluid on the other side, so there would be not over the infusion pump. So this is a design change which you would do, or maybe a process change you would do, which is a proactive approach. And there are various tools you can use which are available, and you can go through, and FMEA is one of the very common tool which is used, failure mode effect analysis and HERA. So these are some of the tools which you can use to do a risk assessment. And what makes the risk assessment so important? Because two things are very important. Whenever there is a risk, there is a time is lost, there is a safe patient safety is jeopardized, or the safety of the staff is jeopardized. And also when you treat the risk, So then it becomes a very expensive approach. So when you manage the risk, so it is important that we do a risk assessment prior and try to save time and money both. So that's important. So the key consideration I would like to highlight, so this would be the highlight of this presentation. Don't put off. So don't put it off. The risk assessment should not be put off. It should be continued. Even, I'll explain to you, it should be an annual exercise which you should do, because in a hospital setup, there are multiples of equipments which are being handled, whether it's a small equipment to a large equipment, and you should make a plan to identify the risks with related to the specific equipments, and try to prioritize the risk levels for that particular equipment, and try to continue if there is a risk is not it's not being treated effectively. So don't put off the risk assessment, try to continue that. Work with teams, it's very important. Very, very important point is the teamwork. Now, when you work with team, you have a great inputs and you can effectively manage the risk. Then keep the risk assessment live, and that is, yes.
I am so sorry to interrupt you, but this is my usual
okay.
prompt.
Okay, thank you very much. I would just take 1 minute. That's all. So keep the assessment live, record all the thoughts. Like we all said, that report the medical errors or report any incident, whether it's a potential or whether it's an adverse event or a sentinel event, always record all the thoughts which has come in with respect to safety of the equipment, and then define the level of risk. Now, how do you define? So there is a grid which you see, there is a severity of harm and the probability. So this is a matrix which you plot, and you accordingly you divide the levels. So the risk can be unacceptable, it can be, you can further investigate it, or maybe a negligible risk. So you can avoid them, but the red ones should be treated. And this is another matrix, which is the consequences above the multiplied with the likelihood. So this is again so one slide, which I just take half a minute on this. This is a risk assessment and management plan. This is from my organization only. We did it very, very comprehensive risk assessment across the biomedical equipment department. And these are some of the examples, because we've been doing it over the years. So what we have done is that we have, used the probability and the severity matrix, and we plotted the scores accordingly. We have given the scores, and this is done in the teams. So when we sit together, we prioritize what are the risks which we identify in that particular annually, which in the particular biomedical equipment department, and then you score them. And when you get the risk score, you try to see what is an organizational response and your current state of preparedness. And when you have that particular level set, you would see that either the organization is fully prepared, or it's partially prepared, or it's negligible. There is no preparation. So then also, depending upon the risk level, you will draw a risk management plan and a timeline. And this should be followed, and it should be an annual exercise minimally. You can also do a so this is from the JACO tool, which has a reference tool, which I have used here. And we can talk later on also offline with respect to this tool. And the other one is the FME, which I spoke about. Thank you very much. With this challenges slide, I would leave the thoughts in your mind and do more introspection on the challenges and how to deal with it, because nothing
Thank you,
is...
Thank you. Thank you very much. Thank you so much. So it was, of course, a very interesting talk, and I'm sure we can deal more on this. Some of the matrices which you've shown would require time for understanding and in-depth consideration. So I'm sure we can have another workshop